Okay, what about pregnancy? Well, let's introduce this by talking about pregnancy without an MGB. Well, there's danger. Danger to mama and danger to baby in the pregnancy. The heavier mama is, the more danger there is. The dangers that we commonly see in pregnancy are eclampsia or preeclampsia, high blood pressure, having to be put to bed, high sugars in mama, high sugars harm the baby born too big or too small, and all of these complications worsen the heavier mama is. So when people ask about the danger of pregnancy after the MGB, we have to balance that with the danger of pregnancy without the MGB. And basically, heavier is worse on both the health of mama and baby. Now, what about the MGB? Well, we're in a good situation because many of our patients have had babies before their surgery when they're heavy, and babies after when they're now thinner. And what we hear over and over again is when I had the baby before the MGB, I had eclampsia or preeclampsia or small for gestational age baby or high blood sugar, gestational diabetes, problems like that. And afterwards, I had a healthy pregnancy and none of those problems. So we say in general, the research is pretty clear that in an intelligent, well-managed, planned pregnancy, we expect that it's actually safer to have a baby after the MGB. Now, I put in there a caveat and said intelligent and planned. Let me show you that there is a situation in which a person could have the MGB and have a devastating complication in the pregnancy. After surgery, we educate our patients, we force you to do the packet, and we want you to learn about the risks of low vitamin levels and low iron and low nutrition after the surgery. We ask you to prepare for a pregnancy by checking with your doctor and making sure that those levels are normal. And it's possible that someone could ignore that advice. They could not take their vitamins. They could be suffering from extremely low levels of folate, a particular vitamin. And low folate can lead to a devastating complication, maybe the worst birth defect I can imagine, a baby born without a brain. Low folate is associated with the birth defect anencephaly. Now, we've never seen that. We've actually never seen a low folate in our patients, but someone could have this surgery, say, oh, I'm normal, ignore all of our advice, and get in trouble. So we can't guarantee that baby will be better born after the MGB. There is some personal responsibility in making sure that you take good care of yourself in preparation for the pregnancy. But someone could be like an alcoholic, not have an MGB, have a terrible diet, and give birth to a child with that birth defect, even without having an MGB.
But the concern of being able to get enough nutrition to the fetus is not a concern.
Right.
She also has polycystic ovarian disease. Do you have any experience with what that does to her?